grilled or barbecued oysters or whatever they have.
Yeah,
The
they'll make them any way you can.
Acme Oyster House, I think it is. But
If
yeah, there's some
that's the
it.
one, yeah. Which you're
Yeah, I think
like,
it's.
as I don't know how old you are, but I think we're kind of the same age. Where in regards to like, wait a second, Acme, like, isn't that off the cartoons?
Yeah, it was
Like,
like the
is the Roadrunner
the
gonna
the
go? The
road
guy?
the Roadrunners dynamite supply, I think, from the Acme place. Yeah, those I've
Lindsay's
tried
pretty
to.
young.
You can go back and watch them. I don't even think those
You
cartoons would not be they would not be PC in today's world. I think
no,
they're smoking
no,
smoking
no,
cigarettes and blowing
no.
blowing other
Blowing each
cartoons
other
up.
up, right? That's just violent. It's too violent.
I wonder how good. I mean, what was the other thing? Oh, the Brady Bunch that came on. I saw something about that last week. In fact, that was a mainstay at the Potter household growing up. GI
Yeah,
Joe. Oh, I like the
yeah.
GI Joe too. Well, we got people filtering in here. We'll get started in about 60 seconds. Um, for those that are on the call, let's give you we'll go through the rundown while we're waiting for everybody. Um, Make sure you use the Q&A tab at the bottom of your screen, assuming you got the Zoom browser open for questions. Lester's a great open book here, so take advantage of it and give you the straight answer. Um, and other than that, I think you guys have been through this. So feel free to ask questions. I'll filter them into the conversation as we go. And we are 2 minutes past, so let's get this party started.
But
Throw the slides up.
got it.
All right, welcome to our November fireside chat, and we're finally, well, at least us West Coasters have weather that is fireside chat appropriate. It's been a stormy one out here in the Washington area, anyways. I know that some of the others are in some drought and heat zones, so maybe keep your fires low out there. But this month, we got Lester Morales joining us, so always a treat. Lester's been on the program before, brings great energy. It's a nice balance to me, so he'll liven this party up. We'll ask questions as we go, and I really like it when the audience brings those questions in. So again, use that Q&A tab to ask those questions, and I'll build them into the programming. Lester was the chief growth officer for Willis, built up a phenomenal business over there, and then decided, there's knowledge that can be shared. So he started Next Impact, where he's been out working with advisors across the country and doing a great job of it. So I feel very honored to have him on our program today. He's going to be diving into all kinds of things that I think need to be talked about when it comes to using reference-based pricing. There's different ways that people use this. Some use it to go get new clients, others use it to enhance their current book of business. And each one of them takes some nuances that need to be done correctly to make it successful. So Lester's going to dive into all that today. So Lester, welcome to the program. I think we're kicking it off with starting from the trenches here. So we'll get down and dirty early.
Awesome, awesome, awesome. Thanks, Heath. Thanks everybody for joining. So here's what I thought when Heath and I were rapping about what we do. One of the things that drives me crazy about webinars and even conferences is, we all go to them. You write down, all you got 17 pages of notes. You've heard people, talk about the finished product, right? We talk about the cake and we show pictures of the cake. But what doesn't happen is there's not a whole lot of stories of what was the crap storm that went into cooking that cake. And I thought we would dive in and really talk about some of the war stories and some of the things to think about as you're building. And so we're gonna specifically talk about everything that is unbundled type of health plans. And so, the way I look at this, there are 5 must. that go into this. And I'm gonna kind of go high level and talk about this. And then what I'd like to do is actually I'm gonna show like real life presentations, to be able to kind of look at like some of the tools that I think 6 Degrees has that have been absolute game changers in regards to having conversations with prospects and clients, but also just tools that are available. If you've ever followed anything that I do, I'm very much a rising tide lifts all boats. So if you're on this call, it's because you actually give a crap. We don't see a bunch of advisors attending these types of calls that are going to go out and want to just place more business with the bukas. And so, I really feel like if you added all of us up together, all of the business that Heath and 6 Degrees has, take everybody into every independent TPA, every transparent PBM, we are a rounding error when it comes to the whole. And so I hope, like, if we were sitting here live in a room, I'd tell you, look left, look right. That's not your competitor. And so I hope as we, have these conversations, everybody will feel free to be open and honest about questions that you may have, and then also sharing something. So, let's start with data, whatever it is. A couple of things that I really, truly, really encourage people to do. Number one is people buy. So I'm going to go from a sales standpoint. People buy for emotional reasons, but for logical explanation. So when you're having conversations and in this talk track around reference-based pricing and a bunch of things like that, remember a couple of things. Number one, the data, however you pronounce it. Heath, how do you say it? You say data or data?
I'm a data guy, unless I had a cocktail and maybe it becomes
We're
data.
gonna
I don't know.
drunk Heath is data. So
Sober Heath is data.
there you go. But the conversation. So when we have this conversation about using the data for emotional reasons, but bringing very logical explanations, you have things like the annoyances of paying $6,000 for an image that you could have got for $700, right? And being able to show that from a practical standpoint early on as an example, but then getting the data from the client to be able to prove that that's happening in their own plan. You'll be shocked. I've had 2 prospect meetings this morning alone, showing clients their own data on the things that they had no idea that they're even going on in their own plan. So remember, most CFOs, most of advisors that we work with, they're not looking at things from a claims level standpoint. So, make sure the storytelling that you're using with the data sparks a story, sparks emotion. You're going to want to do that, and you're going to want to pry that emotion out. Sometimes I like to ask, hey, who in the room has had a healthcare experience lately, and what happened, if you're okay to share? Well, nobody loves healthcare, guys. So like asking those questions are a great way to get the room talking, and usually about something that happened that was somewhat negative. And if we go back to the first type of conversation where like so few clients are actually doing this stuff, the reality of that is most clients are going to have a bad experience in the normal model. Well, if you think about it, in the normal model, if you're confused about where you go access healthcare and you just have a BUCA carrier, who do you call? If you get a balance bill, which happens 6 to 7% of the time in a normal PPO, who do you call? You don't have an advocate to call. You don't have someone from the 6 Degrees team to help you with a balance bill. You're dealing with that crap yourself. So I like to ask those questions, bringing data into the conversation, asking them the questions to spark the emotion. And then when somebody says, oh yeah, we had an employee who was dealing with a balance bill, stop them right there and say, hey, Jenny, how did you guys deal with that balance bill? And they're going to tell you either HR spent hours on the phone digging around, the broker spent hours digging around, or the member was just out there swimming for themselves. So, the reality of it is, I just encourage, don't be scared of anecdotal stories showing data, even if it's not the client's own specific data, because part of the goal of building that bridge from top of funnel, hey, a prospect very cold, to bringing them down the funnel to a warmer or even hot prospect, is somewhere in the middle, getting their data from them and being able to use their own data in storytelling. The second thing about data, one of the major brokerage firms, I'm not going to pick on anybody, but their reporting is called a monitoring report. Okay. I don't know about you guys. I want somebody managing my cost, not monitoring my cost. So, I like to have conversations about, hey, when you, Mr. CFO, Mrs. HR, Mrs. CEO, are actually in the trenches doing something about it, how are you actually managing costs? Because most people think you can't control the actual cost of healthcare. But again, we're having a conversation, let's just say, about reference-based pricing. I can actually control and change the way we fund and actually the amount that is paid for that healthcare. So you want to ask those questions, but we got to start using a little bit more actiony of our role as advisors, being a lot more in the weeds and in the trenches. And then the last thing, and it drives me absolutely bonkers, and whoever wants to argue with me can, but since I'm the only one that has an open mic, you have to sit there and take it, which is free work. Man, it drives me crazy when people are like, I don't do any free work. Bullshit. Get some clients' data and do some work around it. I can't tell you the close percentage difference that if you're working on a prospect and you actually ask them to either give you a letter of authorization or to give you the data, the difference in the close percentage that you have when they're that engaged to give you authority or actually give you their data. So it is a checkpoint down the road that you're spending time on the right things. So go ahead and ask for data as many times as you can get it, because there's a lot of things that you can do. All right, Heath, I'm gonna take a breath every once in a while. If you have a question or something, I can get on a monologue. So I have no.
No, you're doing just fine. And now you got me rethinking this data versus data thing, and I'm not even sure what I say.
I don't know. Maybe that's a
You
poll
know,
for the audience, whether they say data.
yeah, we can. How do you write
How do
that
you
out?
distinguish? I don't know.
Yeah, I don't know.
A big A is
So,
data.
so the big thing that I think a lot of these guys are thinking of themselves is, okay, I wanna go beyond the norm here and get some of this data. Um, yeah. What do they do? I think there's a lot of pushback from the incumbent, or if it's fully insured, or you got any tricks of the trade to help folks get the data?
Yeah, so let's put those in two things. I'll also say, for those that you don't know, I spent 15 years as a broker, 9 the first round at Willis, and then another, 4.5 the second round. I grew my own $3.5 million book. And I will tell you, one of the things that really worked for me is, if you're not yourself, and if you're advising or talking to a prospect, a great way to have this conversation, Heath, about the data is every single RFP you write, you should be saying to that vendor, to the people quoting on that business, in order to win this bid, I must get this data in this format on this frequency. Now, when you're setting that expectation, when you're sending out an RFP to the marketplace, and that's saying it in there. Now, again, maybe sometimes you don't get as formal, and I know we don't always get this formal, but if you can think about answering a municipality RFP, they're putting it as almost like a legal binding document that says, I gave you all of the conditions you needed to meet. I'm assuming that these are all met. So the reality of that conversation is, that's almost like a binding contract. So, in this conversation with advisors out there, one, I would start doing it with your clients, but two, this is a great conversation with prospective clients that are saying and complaining, Heath, hey, I'm not getting the data, whatever, whatever, whatever. It's like, oh, did your broker not put that line in the RFP? And well, that's what we would do if we took you out to market, is you get people while they're begging for the business to agree that they're going to give you some level of data. Now, we all know that sometimes that answer is going to be no, but the reality of it is that it's a great talk track, and it allows you to have the talk track that says, hey, by the way, all of the normal carriers told me to go pound sand about requesting this data. It's why I've been talking to you about this unbundled approach, because we don't have this issue when we're over here. So that's kind of, very early on. And then I'm going to show some actual presentations about how I use the data that we get to tell a story. So I'll save that for a little later.
Cool.
So second, conversation is be okay having tough conversations. And tough, I made a cheesy acronym. One is the T is today. I can't tell you how many conversations I have with brokers. I'm like, well, did you ask the client about this? They're like, no, I was going to save that. No. Stop. You can't sell unbundled plans. You can't sell reference-based pricing the same way you sell United Healthcare bundles. You can't. Don't try to do it. You're actually defeating the entire purpose of the movement of transparency, of reference-based pricing, of transparent PBMs. You're throwing the same shade when you're not purposefully having this conversation that it is different. And the reason it is different allows us to do the things that we could do, from saving you money to getting you to better healthcare, et cetera, et cetera, et cetera. And the nuance of why it is different is the magic. And so, to not have that conversation just completely defeats the purpose. Second, everything that we do has to be all about you, and all about you as the client. So I can't tell you, Heath, how many times I go into meetings with brokers. We start the first meeting or second meeting with a client, and we don't know anything about that client. Not so much about who their carrier is and that they're self-funded or fully insured, but what do they want to get accomplished as an organization? If somebody wants to hire a new, chief of sales, or open a new office in Albuquerque, or HR wants to hire somebody new, and you're showing them a projection of a $3 million savings, if you knew that that's what they wanted to get accomplished, can you imagine having that conversation? Says, Mrs. HR, you told me in the beginning of the meeting that you wanted to hire 2 new people for your team. Now you turn over to the CFO. Hey, Mr. CFO, I'm showing you $3 million of savings. What do you think if we gave you $2.5 million of savings, but we gave HR a $500,000 budget to hire some people and to restock their team? Do you think that would be an okay thing? HR's super happy with you because she's been begging to hire new people, and the CFO now doesn't have to fight and shove it down HR's throat that maybe, hey, this move is actually going to be easier and or better, for a whole lot of words, easier and better. And the 2 F's, one is showing the financial win for everybody. I can't tell you how many times people don't take and throw savings both at the member level and at the employer level. So if you're building plans that don't have some level of savings for the employee to be a better healthcare consumer, I'd tell you to rethink the way you're looking at plans. But theoretically, again, if what we're building is a little harder than the norm, then the reality of it is, just like your parents used to bribe you to make your bed, or my parents beat me to make my bed, but let's just say bribe because it's more appropriate. The reality of it is, incentivizing people to act accordingly is going to now be able to, when you're having that conversation with that employer, really show them that the value of these types of strategies is not only organizational in nature, it is down to the thing that they are wanting to control, which is talent, right? Number one issue for all employers right now is talent. So being able to connect those two. And then the last one, which is, been a cool new conversation, is all around fiduciary. If you're not having conversations, again, depending on the size groups that you're going after, you should be talking about fiduciary, the CAA, and these abilities to use plans like reference-based pricing to take out gag clauses, to see actual pricing, to be the right steward of the money. If you're not having that conversation, so the tough acronym was kind of cheesy, but it fit in a couple of categories that I wanted to talk about.
Hey, is the on the fiduciary side, ever since the Johnson & Johnson deal came up, I think it's brought some more attention to this. But is that resonating, at the employer level? Are you finding success with that? Is that something they're paying attention to?
Yes and no. So I would say fully insured, 87 life group, no. 2,500 life group, when you show them that they've got a $95 million potential liability. So I also think it's incumbent upon us as the advisor to make it a big deal, right? Because if you think about it, and I didn't know this, so free advice for everybody on this phone. On the property and casualty side, so if you're at a firm that has benefits in property and casualty, I would walk over to the other side of the office right now and talk to them about this, but I didn't know this until about 6 months ago. On the P&C side, employers buy fiduciary liability coverage. It's an actual P&C policy that protects that employer against ERISA-based claims. Well, the only ERISA-based claim that they're thinking that they have any liability in their head is their 401k. And so it's a great conversation to be able to have now that says, hey, your number one potential liability that could trigger a fiduciary liability claim is something that you've probably never heard of. So Heath, in that scenario, I've seen brokers win BORs because they had the conversation and their incumbent broker didn't have the conversation. So whether that client did anything different before or after, just the sheer conversation of, did you know that this is a risk? And then there's a timeline slide, and I'll try to find that presentation real quick. There's a timeline slide that Pat Moore, who works with me, he always shows on the timeline of when the 401k stuff really started to gain traction. It was after all of the class action suits started. So Johnson & Johnson was first. We've already had a couple more, obviously. Wells Fargo paid what, $38 million to settle theirs. So this is just a matter of time before we're going to see a lot more claims against employers in class action suits.
Hey, speaking of just having the conversation, I mean, I could tell you my stories, but people are here to listen to you, so I'm curious what you've heard. It's come up where you talk to a broker that's got groups that are, traditional network, and they ultimately lost or won groups because they actually brought up the discussion around these alternative models, whether it be reference-based pricing or something else. But you hear the stories of guys that lose groups because they just didn't think they were the right group, and somebody else is out there talking to them about it. I mean, you got any storytelling to do around that?
I would tell you, Heath, I'm not kidding. Let's say I bet on a course of a week, I am on 15 or so employer calls with broker partners. And we're there as an extension of their team, right? Sometimes people are talking about us being part of their national practice, or shoot, I'm on more people's websites as, their, cost containment guy or whatever it might be. But I would venture to bet that of the deals we help brokers win, we only win about 30 or 40% of those deals. So the only talk track I am helping that broker on is about unbundled plans they win a BOR, client says, I'm not necessarily sure I'm ready to go down that yet, but I like the fact that you brought it up because my incumbent broker didn't. That's happening a lot. So I would tell you it is happening way more. And I also know people that have lost business with it. And so best practice I've seen is agencies are hosting large form webinars for their clients, and they're calling it, somewhat of like innovative day. And it's like, hey, we want to make sure that we're bringing these things to you. You might not be ready, but we wanted you to hear it first. And then what we're doing is kind of, at the 45th minute, we're doing a call to action to the clients and saying, if you think that you want to explore this, now raise your hand. And so that way, as an agency, you could talk to as many people all at one time. The people that didn't raise their hand are not interested in it, and the people that are. And so you can kind of spend your time a little bit more efficiently is some of the best practice that I've seen.
Yeah. Yeah, I think sometimes you think about all the different things an advisor needs to know. You can only be an expert in so many things, and that, to some this may seem complicated. To me, I've been doing it for most of my life, working life. And so I think sometimes we forget that these are more difficult, discussions that you have to have. But you can put a playbook together. I think that's where you could help out, or I'm happy to have those conversations with anybody on this call, and give you that talk track so you can at least get the conversation going.
It is the fourth out of fifth thing I'm going to talk about here, which is
Oh,
picture book.
am I screwing
No,
your whole program
it's
up?
perfect. But here's something I want to show somebody. So this is a live prospect presentation. I think I de-identified it everywhere I needed to. But this was just a review on their RX program. So mind you, they're with one of the big brokers, and we asked them about their gag clause attestation. They said, oh, yeah, the broker and the carrier filed it for us. So I said, well, technically, if they filed it for you, they attested that your contracts currently do not have any gag clauses. Can we see the contract? So we had the RX contract reviewed. There were 21 gag clauses in their current contract after their broker and the carrier said, no, we filed this for you. The size of the group, it was a $94 million claim. And then we went through and showed them where they have gag clauses in their own contracts. And so again, to your point, not an easy conversation to have, but you don't have to do everything yourself by yourself. And we're gonna talk about that here in a second. Success stories. Man, if there's something I could wish our industry did better, it is share the good shit we do. I don't know if I'm allowed to say shit, but I already did. So, oh well. So share the stuff that we do. Like, I call it the flight attendant rule. Nobody gets off a flight that worked exactly the way it is and walked up to the flight attendant and said, you know what? My pretzels, they were delicious. And my Sprite had the perfect amount of bubbles. We got here on time. My luggage didn't get lost. Man, thank you so much. Like, that's what you pay the airline to do, is transport you from point A to point B on time like they said they were going to. But sure as shit, if we're late 10 minutes, you're going to give them the thing. And so clients, let's go back. The clients of the clients, the employees don't come up to HR and very often. We get the success stories, but not as much as we get the pain point stories. And so I would tell you, as an industry, if there's a call to action I could make for the people that are on this call, if you have a plan that is doing any function of unbundling at all, even if it's its simplest form, please start sharing using social media the good news. If we all every week posted 3 or 4 things of like good stuff that happens, that creates man, there's a lot more people doing this than I would have thought. I don't even care if it's 100% true. But the reality of it is, like, things are going so well so many times, but we don't share that story, and it drives me crazy. Heath, I don't know if you see that, but like, I'm sure you get all of the noise, but very rarely is somebody calling you being like, hey, Heath, I just want to thank you. That plan you sold me is working exactly the way you told me it would.
Yeah, funny story. I actually had a guy come and jump on my back on a tropical beach and give me a giant hug and say, "Thank you, man. You saved us millions of dollars." But that was, the rarity where where
And
someone's
I'm
willing
assuming if a,
to.
I'm assuming if a grown man jumped on your back, it was intoxication too.
Yeah, we were saying data, not we were saying data, not data at
Data.
that
Okay,
point. But
you were data Heath there.
I
Okay.
was data Heath then. But no, I mean that's a conversation we have internally all the time. Is people will voice the problems, but I think as an organization we need to, and I think we've actually been creating QBRs and other conversation points that we have on a regular cadence, but sharing the good, because I mean even the best RVP plans are going to have something that you can poke at, right? There's going to be problems there, but overwhelmingly, it's very successful.
Yeah.
So that's I think you're spot on with that.
So the last thing is, or not the fourth thing is picking your partners. One thing that frustrates the absolute crap out of me, I think we're pretty good at what we do. I think I can have a really in-depth conversation. I've been on the broker side. Pat started his career off at Aon. Katie, who runs our service team, came from a very large TPA. We're all self-funded nerds. I mean, we geek out on this stuff. And the number of times brokers are hesitant to put us in front of clients because of their hesitancy of not being the smartest person in the room drives me absolutely bonkers. It's such a scarcity mindset as opposed to an abundant mindset. It drives me bonkers. And then the analogy that I'm going to give everybody to hopefully help you with that, hesitancy that you may have. Heath, do you work with a financial advisor?
Correct.
He does. Okay. So if that financial advisor brought you a specialist that was really deep on cryptocurrency or gold and silver and wanted to talk to you about that, and if you decided that you were going to invest and that person was going to help you make some money and he made you some money or she made you some money, are you A, mad at your original financial advisor for bringing somebody in that was a specialist, number one, and B, are you mad that that person made some money because they made you some money? Are you mad at any of those two situations?
I'm pretty happy about that, I think.
Right. So it drives me crazy. Like, oh, I don't want to bring Heath into a meeting because he's going to sound smarter about RVP than me. Of course he is. It's what he does for a living. Like, I just don't understand. So if there's anything that I could give to anybody, pieces of advice, stop going at this alone and be okay bringing in people that are on your team, because, a shortstop needs a good pitcher. I mean, that the quarterback needs a good wide receiver and a good right, tackle to be, helping them out. I mean, it's just kind of the deal, and it drives me bonkers when people don't think about it that way. Last thing, if you are not out there marketing from a digital standpoint, you are missing the damn boat. And Heath, we've been in the business long enough to know where I would have never thought that a majority of my sales would come from webinars, seminars, my podcast. I mean, the number of people that we get in that are like, "Hey, I heard a podcast about this. I have a question," or whatever is just crazy. And I think right now in this day and age, nobody meets somebody or hears about something, and one of the first two things that they do is either A, go Google that person, or B, go on LinkedIn and check that person out to see if they have any type of credibility. So, again, I don't know who's making up the audience on this, but if you have been hesitant to get out there and be socially creating a brand and a reach much further than you could do on a one-on-one basis, you are missing the boat.
Yeah, we started I'll be the first to admit I'm not the world's greatest social media guy, but I've got a marketing team that helps keep me at least somewhat on par. But we started this series because of COVID. Scott and I were out doing live presentations or live, seminars weekly back, pre-COVID, and then that all came to a screeching halt. And we had to think outside the box, and that's where the fireside chat thing began. But here we are, 4 years later, 5 years later, whatever we're hitting, coming up on the anniversary of that. But I do agree on the other social media components is creating credibility, creating reach, and just being present. Staying in front of people.
Yeah, it's nuts. What people won't do. All right, I thought I would actually get in the weeds and share some things. Number one trick of the trade I always use, if you're not setting out, this is kind of a little salesy. Hey, what are you trying to get accomplished in the meeting? What do you know about them? Tell them some success stories, but the way you want people to introduce is just huge. The other thing that I like to have a conversation about, and this was using data to sell. So first of all, let's go a little bit of props here. I think most of my presentations are going to have a 6 degrees folder or chart here. And I want to show this so that people can understand that the cost and the quality of healthcare changes depending on where somebody goes. And so why would you allow somebody with lower quality be billing at such a high number around there? And then the spread between the blue and the green is why reference-based pricing makes so much sense. So like graphically, most people haven't seen things like that. They understand the narrative behind it, but I don't think most people have seen the variation in the price tag with it. So it's been a great tool for me. So thank you, for having it. But like, this is a wonderful tool. If you're not using it, you're missing the boat, because it can get down to a particular hospital, a geography, a state. You can click on and do a DRG code. I mean, you can do a lot of different things if you know how to do it. So, big props to 6 degrees. But if you don't know how to use this as a sales tool, maybe Heath, that might be a nice little session you guys can run to teach people how to, have the conversation using it.
Yeah, it's funny you bring that up. Sometimes I forget that not everybody has seen this or used it. I've, back over the years, I've built it into every webinar and presentation I think I've ever done. And for the advisors that are working with us, you get access to that benchmarking tool. And so if you're not using it today, I'm happy to have that conversation with you. Reach out. You should have my contact information. If not, it's at the end of this program. But selfless plug, our app based MetaV, which does not include the benchmarking tool because it's something that the members will have access to. If you haven't seen the demo on that new release, it is really amazing. And our IT team was tasked with making the best RVP app that exists, and I think they've accomplished it. So it's pretty impressive what you can do with that tool now. Everything from seeking out, RVP approved or contracted components to pushing a button and having that ring through to somebody on our concierge team to have a discussion at the front desk about getting in the door. So, and then everything else, managing your balance bills or access issues. It's a really slick app.
And here's what I love about that, right? You're in a prospect meeting and somebody says about the balance bill, right? Because hey, if you've been in a PPO, you've gotten balance billed from an anesthesiologist, something that has occurred. And it's like, well, what did you do about it? Hey, let me show you this. Boom. And now you have it on your phone right there. I mean, there's just a lot of really cool things that if you get your story down, it really helps. Another thing about data, depending on the number of bourbons, this is top drug spend, and this is a really large group, 12,000 employees or so. So, you'll see they spend a crap load of money on specialty drugs, but just their top 15, if you added this up, right, 24 minus 13, right, call it 11 million bucks on 15 drugs. So we worked with PBM partners to, kind of show them, hey, there's between 4.1 and $5.5 million using your own data of savings potential using international sourcing or manufacturer's assistance programs. That's vendor one, partner two, showing a different thing. And so what I love about this is, it's their data. So in this conversation, if we went back to the source data, this is just your standard quarterly report from this particular carrier that the group handed us. It was in their inbox. And so it's like, wait a second, if you're paying $11 million and we could save you somewhere between 3.5 and 5 on that same 11, and these are only 15 drugs. Now, the coolest part about it is this was only 935 members, and I believe the total is something like, 14, 15,000. So when you look at it on a percentage basis, we're talking just a couple of percentage points of people are spending that much on their specialty drug. A super easy conversation to be able to have. So super low barrier of access of getting that data. It is their standard quarterly report. And in the first meeting I had with that client, I showed them the same report just from some other client's data that was de-identified and said, hey, this is what normally happens. My goal of this meeting would be to actually intrigue you enough that you're going to give me this data for you so that I could come back and show you this for your group. So it's automatically buying the management of expectations of what you're going to show. Guys, we had the best analytic teams that you can have in my former life. We were not doing this type of analytics on a pre-sales basis at all. So put yourself in a competitive advantage to be able to have that is such a good opportunity. A second piece, and this is 6 degrees props here. Why? Okay, here we go. This is a RBP savings analysis that 6 degrees can do for you if you give them some data. So this was a prospect that I've been talking about RBP, and I'm like, you know what? Don't believe it from me. Let me show you an actual analysis using your own data to be able to do that. Look at the savings potential. So we were able to kind of talk to them about, hey, that number that's at the top where XYZ Buka says they're getting a 60% discount? 60% off what? Have you ever thought about that, Mr. Client? And this allowed us to have a really good education using their own numbers because we were able to get this off of their data. So again, this only happens, A, if you're asking for the data, B, that you're intelligent enough to have the conversation. But let's just pretend I didn't know how to have the conversation. This is literally data I sent over to Melissa on Heath's team. She did the analysis for me. And again, I can present this myself, but I'm sure, Heath, your team would be more than happy to present this to an employer client if given the opportunity.
You would embrace the opportunity, yeah.
And so guys, again, this takes free work. So it takes a lot of work. This client, we didn't win. Actually, the broker, because the broker didn't put this in front of the client long enough, they actually lost this deal. They got BOR'd in the middle of this because they refused to put RBP in front of this client until we brought it to them, and they were hesitant because they're like, oh, the noise, oh this, oh that, and then they got BOR'd. You think they're ever going to wait to put RBP in front of their next client or prospect? Right? These are all lessons learned. I'm going to show one other thing, and then I was going to end with some lessons learned here. Any questions, Heath, that you're seeing over there?
I don't see any questions, but I will make a comment on that savings analysis since you brought it up. That's something that we are happy to do. And you don't have to have a perfect data set for us to put it together for you. I've got some uh, really great analysts on our team that can take any number of segmented pieces of data and create a pretty telling analysis. We typically do those on a pretty conservative basis, so you're going to under promise over deliver on those things. But we do have to have a little something to run with, whether it be build charges or obviously if we got the whole data set, that's great. But if you do have a client and want us to take a look at it, we can run that for you. It's very telling. Um, it's a great conversation starter, especially if you're having an RVP discussion for the first time. We'll get their eyes wide open.
So last set of data I'm gonna review here real quick. If anybody saw, I did like a 3-part series on LinkedIn reviewing this. So I'm hoping I'm not going to get in trouble reviewing this, but these are just things that I like to bring up. So this is a normal data set provided by a carrier to a client. And so I'm looking at things, I'm like, all right, if I see something that says my costs are 42.5% higher than the norm, and there's no way that's showing me how to actually do something to actually mitigate the cost. So again, so much of what happens in our business is carrier reports or the reports you guys as advisors are putting out show the number. Ask yourself everything that you put on a report. So what? What is the actionable piece of data? So in this scenario, like, hey, why are your costs really high? And 2, like on this RX side of the house, we could murder this. And in fact, there were 3 drugs. So they only showed us 3 drugs. Those 3 drugs versus what is typically paid would generate $16,000 of savings for this employer. Total drug spend is 40% of their overall paid. Well, the benchmark is, less than 25. You're paying 40. I don't know. What did your advisor say to do to this? What did your carrier say to do to this? We showed them some examples here. This was a great one. One of our partners on the PBM side, they actually published a list of the drugs that were actually on the Johnson & Johnson lawsuit. And then they will run a report against it and says, hey, if we actually got the drug information for that client, we could show you that your plan has also got some of the same drugs that were included in the Johnson & Johnson. So these are questions that I like to ask. And if anybody wants these questions to be able to send out from a prospecting, just, contact me. I'll send you this, more than happy. But these are great questions to ask prospects about their current PBM. So again, hey, what are the strategies that you could do about it? You spent 90%. And so Heath, this is a great conversation. Look at this slide. We've got a bunch of high cost claims, a bunch of outpatient facilities. And, when I asked the prospect, well, so how did you have a conversation about what you could actually do about it? When somebody were to bring you into a meeting like that, or a prospect asks you, how do you have the conversation? Says you spend a bunch of money on, catastrophic. There's nothing you could do about catastrophic claims, Heath. What does Heath counter on that?
Nothing you do about catastrophic claims?
Yeah, that you can't do anything.
Well,
A claim is a claim when it's a catastrophic claim, Heath.
no. Well, I guess it depends on who you're working with, but that's part of the PI program that's built into the 6 degrees solution. RVP itself is incredibly effective at managing some of the catastrophic claims, but when you add nursing teams to review to make sure things are properly billed, it becomes even more effective. So, and the other thing it does, if you're doing an unbundled approach like this, it slows that claim down. And gives everybody a chance to get involved with it and make sure that things are appropriate.
I mean, what I love having, and I have a podcast episode about this. Like, I remember myself sitting, wearing the logo of one of the top 3 brokers in the world. My largest client was 150,000 lives. Like, I dealt with some big stuff. And I remember saying, a claim is a claim. I said it came out of my mouth before I knew that there's all of these other tools that you could do. So, if you've ever said that, wipe your mouth out with soap, because there are absolutely things to be able to do with it. And I think that the reality of it is, there's just so much conversation that you could do if you're having the data. And again, if you don't know how to review the data and be able to do that, then I think that there's, easy ways to be able to do that.
Are you using any of this data to have discussions with the stop loss entities?
Oh, our submission. So the way we do a sales opportunity, we get an RFP for a broker. So again, not this isn't a sales tool for me, but like, we only help brokers win business. That is 100% of our business. We are not a broker. We only help other brokers win business. So a broker sends a submission in. The first thing we do is an impact analysis and review the data to see if there's anything that we could send to you guys, to send to the PBMs, to send to the markets, to the other point solutions that says, hey, if this is what we're dealing with now on the P&C side, they call it risk profile improvement. How can I improve the risk profile of this client so that the stop loss marketplace in our world views this favorably? So we do it every time. And then when we send a submission to stop loss, it tells them, hey, the thought process right now, after having a conversation with the client already, showing them their impact analysis, they might not be ready for RVP, but they are ready for this and this and this. So we're thinking that the strategic path that we're going to go down the road with this particular client looks like this. And if we do the transparent PBM, we got 10 drugs. All 10 drugs have a program. There's $185,000 worth of savings. This is how we're going to have a communication strategy. This is our enrollment strategy. And so we give them the full picture of what the strategic path is while using that data. It's a must.
Yeah. Well, I completely agree. And I was kind of setting that up for you, but it amazes me the number of folks that I talk to that don't utilize the tools that that we're even handing to them. And we hand over that full analysis. It's like, have you had that conversation with your stop loss markets? I'm like, no. It's like, you'll be amazed at what you can accomplish when you hand them over or something like that. And it lays out the the proper underwriting for them. So.
The way I kind of think about this in a non-geeky insurance world that we live in, right, is insurance is a sophisticated form of gambling, right? We're betting on ponies. And if you've ever gone to the Kentucky Derby or any horse race, there's people that are handicapping the horse. Showing data and doing analysis is handicapping. You're being able to try to figure out from an underwriting perspective, who are the horses to bet on. So I think the employer's willingness to do this, but I also think you as an advisor, stop loss markets, and if there's anybody that's on from a stop loss carrier, I mean, please chime in. I'm assuming that a stop loss market is going to be very favorable to the broker who did the analysis beforehand, who showed the data, who showed that they care, who showed that they had the conversation with the client, who got the buy-in of that particular client about what are the strategies and tools that could go in place. I got to imagine a stop loss market's jumping up and down for joy, saying, gosh, finally brokers that are rolling up their sleeves and getting dirty on this. I just, in no way, shape, or form do I think it's a bad thing.
Yeah. We do have a question that came in. You want me to hold off till after the lucky
knock it
seven?
No.
All right. Are there markets where RVP is a non-starter right now? Question mark. We had a Vermont-based client try it for a year, and it was so poor that they abandoned it after that.
Everything is context and nuance. So there's so many questions I have about what was the rollout of that group. Who was the RVP vendor? Were you, was it a scorched earth model that is like, hey, we're going to pay you 120% of Medicare, screw you, we'll see you in court? Was there any flexibility to the percentage of Medicare? What drives me crazy about that, if people understand, if in its simplest form, RVP is simply trying to come up with how much the plan is going to reimburse for a service that is being provided. That's it. In the normal PPO world, you use a bill charge and you apply a discount to it. In the RVP world, you use Medicare and you apply some percentage over Medicare. But we're coming to the same point, which is like, how much does that MRI cost? So when people say, oh, they hate, or this market hates RVP, what if it was Medicare plus 1,000%? Would they hate RVP in that scenario? So no market hates RVP because no RVP two scenarios are the same. You have the amount, you have the communication and the education that was done, you have what type of claim. 140% for this hospital and this type of claim might be completely cool. And in the same hospital, this type of claim, 140% of Medicare might not do it. So like, there's so much nuance to that I hate when people make, inclusive statements as always and never.
Yeah, we're down to 5 minutes or 4 minutes now, so I want to make sure you can get to your lucky 7. But there's definitely multiple ways of going about reference-based pricing, and just because it's been done one way doesn't mean it's not going to work with building in neural networks and contracting or adjusting the reference point or whatever. There's definitely different ways of going about doing it. So
well, and you look at it like you guys get paid a PEPM model. So if we needed to raise the RVP point, right, it's no skin off your back. You're not getting paid any less work, and it might be more accepting for that model, which in some markets like Florida, where the average that's being paid is 400 or 500%, well, maybe paying 200% of Medicare on that deal is actually pretty good.
yeah, you definitely want to consider what's driving people's actions as well. That's a good point on the PEPM versus not. Maybe there's a reason that people don't want direct contracts in their model, and it could be how they're reimbursed. So just something to consider.
That might be a whole nother episode we could do.
That could be a whole nother episode. It also impacts your stop loss. There's another
100%.
component of it.
All
right, lucky 7. 3 minutes.
My lessons learned, man. Start with your why. It's Simon Sinek's book, but I make sure now I've lost my parents, so like everything I do is to honor them. But like I can't tell you, being able to explain what fires you up in a meeting of why you're going to be so passionate telling them that their current model sucks is it just helps. Don't get high on your own supply. I'm a hip hop guy. You can tell me whose song lyric that is. But the reality of it is, I can't tell you, for the first couple of years, I would get so frustrated that I'm like, I'm showing you an analysis. It's saving you a bunch of money. Why aren't you buying? And there's just so many things of like nuance that I didn't know about that. So just because you're saving somebody money doesn't mean that they're willing to buy. Ask the tough questions early, man. If a client's not willing to leave Blue Cross, ask that in the head of things. So like, if you ask a room full of 100 people who's unhappy with how much they're going to pay for healthcare, everybody raises their hand because they're all unhappy. But after you have these types of conversations and show them how to save, a lot of people, and I'm talking more than half, are like, yeah, not for me. That's okay. But like, have that conversation so far higher in the process. Have a process. I can't tell you how many brokers don't have a process. If you need a sales process, again, email me. I have a sales process for you. It's a 3-step sales process. It is very organized. We can help you. If you want to go fast, go alone. If you want to go far, go together. Stop being a one-man, one-woman. Stop being a lone wolf. We're never going to change healthcare, which is what we're all setting out to do by ourselves. Stop faking it. I can't tell you how many people I see on social media that I know their largest group is 65 employees and they're out there talking like they got, humongous experience doing all this. It's okay not to have, a bunch of experience. the oldest G in this unbundled game is probably only 8 to 10 years old. Like this isn't like an old industry, and it's never too late. I can't tell you how many times I get a broker that's like, man, we've got a $3 million book of business doing it the normal way. I can't transition now. I would be a hypocrite. No, or you could have just learned something. It's okay to learn new things. And so, Heath, I am done, man. It's been a pleasure. I think we could do this for 5 hours and some bourbon. So I look forward to another one.
No, it's been much appreciated. It was great. We'll get you back on again. I do need to announce our December chat. So go ahead and go forward a couple spots. If you think Lester brings the energy, here's good competition on that. Scotty Campbell, and he will be talking stop loss. So some of the things we hit the edges on this one, he'll get into a lot deeper in terms of the impact of these types of solutions in the stop loss world.
I'm gonna have to bust his balls because Scotty and I both started at Sun Life, so I've known him most of my career.
I had him on here a couple years ago, and I needed to take about 2 years off before I could do it again. But it's a heck of a lot of fun. So bring the audience. You're in for a treat. He definitely doesn't hold back. So, Buster, thank you very much. That was great. We'll chat again soon. Thanks to the audience. We'll see you guys next month. Take care.
Thank you.